Hi everyone, and welcome to Southern Health Podcasts, conversations with Perinatal Psychology, talking about maternal mental health because your mental health matters for you and for your families. So I'd like to introduce myself. I'm Blaithin, one of the clinical psychologists with the Maternity Mental Health Service, and I provide a service to Hampshire hospitals. And today our podcast is part of Baby Loss Awareness Week, which is happening from the 9th to the 15th of October. And we're really lucky today to have Laura, a special guest, join us to talk about baby loss and more specifically support available for women who are pregnant after loss in the Hampshire hospitals area. So I will ask Laura to introduce herself.
Thank you. It's lovely to be here today. My name is Laura Mackie. I'm the lead bereavement midwife for Hampshire hospitals, and I'm also a rainbow midwife, so providing care to families in pregnancy after loss.
Thank you so much for joining us, Laura. I think the work that you do is so needed, and particularly this week, I think it's really helpful to have the opportunity to understand more about what is available for families going through these experiences of loss and, of course, pregnancy after loss. And I wonder if we could start there, what you might be able to tell us about what the experience of these mothers and families is navigating pregnancy after loss. What have you found over the years that it's like for these families?
Yeah, absolutely. I think it's a really frightening time for a family to embark on a subsequent pregnancy after the loss of a baby, and pregnancy itself is such a long time. So from the moment that they receive their positive pregnancy test result to the point that they meet their baby are many, many months in between. So I tend to advise families to take it day by day if they need to, and week by week. So rather than thinking about the due date and trying to get through to that point, is taking each appointment as it comes and accessing the resources that are available to help them. And that's not just through our clinics, that can be through the national charities that support pregnancy after loss. And there's some fantastic reading material, some really good books with journaling options in them that can help on a day-to-day level.
Yeah, and I guess what the amount that's out there really speaks to just how challenging that journey is, pregnancy after loss. And one of the things I'm often struck by is just the degree of uncertainty, and when we've had an experience of loss, often how we view pregnancy is changed, isn't it? There's that sense of, wow, something could go wrong at any time.
Yeah, and what's difficult is that we can never guarantee to a family that everything's going to be okay this time, that they'll definitely take their baby home. You know, you can never say that to anybody. And it's about supporting them through their journey step by step and encouraging them to think about the positives that are going on with their pregnancy at that current moment. So grounding them to the current time and saying, you know, baby's doing really well at the moment, and you know, we can't see any reason for this pregnancy to go wrong, and we know that this doesn't always help parents to feel calm and relaxed, and that anxiety levels will always be high throughout the pregnancy.
Yeah, and it is, I think, a real challenge, isn't it, to stay in the here and now and recognise what you do have on any given day, your baby, your pregnancy ongoing. It makes me think, Laura, about the affirmations that we've talked about before that I know Kat Strawbridge has done from Finally Pregnant, and just those moments of pausing and saying, today I am pregnant and I can allow myself to feel joy in this pregnancy. Things like I will bring my baby home, and whilst we can't guarantee that, as you say, trying to hold that hope alongside the fear and uncertainty.
Yeah, hope is a really important thing to be able to feel, and to encourage women to hold on to that hope, you know, throughout their pregnancy. And while we can't give any guarantees, what we can do is to offer longer appointments, extra scans, and the option to engage with support groups locally so that they can meet up with other families that are going through pregnancy after loss, because I think it's quite a unique experience, and most women who are going through pregnancy will engage with forums and groups and antenatal classes. And if they haven't had the experience of loss before, the feeling in these groups is very positive and very looking to the future and planning for the baby's arrival. And when you're experiencing pregnancy after the loss of the baby, sometimes you just can't think that far ahead. You can't plan for the time when your baby's going to be home with you. And being able to say, I'm scared, I'm lonely, I can't think about birth, I can't think about the postnatal period, saying that out loud can be really difficult for somebody with it when they find themselves in a routine antenatal class with other mums who haven't been through it. So it's actually encouraging them that it's okay to feel this way, it's okay to feel anxious, it's okay to feel scared, and it's very validated, and it doesn't matter what happened previously. So in terms of the stage at which their pregnancy ended or when their baby died doesn't match up to the level of anxiety that they might feel, and recognising that every pregnancy that's ended in loss can potentially cause long-term anxiety and stress and emotions which are very hard for some people to understand when they haven't been through it, for us to recognise that and say, it's okay, it's all right to feel this way. Sit with those feelings and know that as long as you're asking for help and you're talking to us and getting peer support and perhaps becoming involved with some counselling even during your pregnancy, all these things will help you through.
And we come, don't we, to pregnancy with our own very individual, unique journeys. And as you rightly say, there's this huge variation in what somebody might bring to that antenatal preparation class, particularly in terms of experiences of miscarriage and loss and wider trauma in their lives. And some of the stuff you've started to describe, Laura, things like having increased appointments, some more monitoring, opportunities to access things like peer support and counselling. I think lots of those things are available under what you've touched on, the Rainbow Clinic. And it would be great if you could, for our listeners, tell us a bit about what Rainbow Clinic is, where that came from, and I guess who it's for, who this is available for.
Definitely. So we as a trust started looking at setting up a Rainbow Clinic in 2019, and we looked first at the Tommy's Rainbow Clinic at St Mary's in Manchester, who pioneered the first Rainbow Clinic in the UK. And we worked very closely with them to be able to set up our own Rainbow Clinic within HHFT. And that's been running for officially for almost a year now. So we have a clinic every Friday in Basingstoke and one in Winchester. And that's run by my colleague Sophie runs the Rainbow Clinic in Winchester, and I run the one in Basingstoke. And we're able to offer continuity of midwifery care from 8 weeks of pregnancy throughout the entire pregnancy. Women are invited to come to an 8-week scan, so that's something that is additional to routine antenatal care. And this means that they're able to have the opportunity to see their baby at an earlier time in pregnancy. And although that doesn't bring in itself any guarantees of a good outcome, we know that it helps mums and dads to be able to see that their little baby is there with a heartbeat in the right place from an earlier time. Our appointments are longer than routine antenatal appointments, because although the clinical aspect of an antenatal appointment may not take as long as the time that we give, we know that this is a really valuable opportunity to encourage parents to talk about how they're feeling, to explore any areas of anxiety, of stress, of trauma, and to be able to support them through that. to point them in the direction of other services that can also they can be referred to, and this takes time. And time is not always something that as healthcare professionals we are able to give. So we're so pleased that we're able to offer a service which allows families the time to engage with their feelings, recognise them, and do something positive with them to try and achieve a happy pregnancy and obviously a healthy pregnancy. Within the clinic, the parents are offered extra scans throughout the pregnancy. We're guided through all of this by our consultants, so it's always a consultant-led clinic. And we are part of the Tommy's research project into stillbirth. So some of our families are invited to join and be a part of this research. So it's not just supporting families through pregnancy after loss, but it's also looking at ways in which preventable stillbirth can be reduced, and reducing the statistics that we're faced with in our climate today. And that is that 9 babies are stillborn every day in the UK, and we want to reduce that. So any work that we can do to improve outcomes, is very, very important, and that's part of what we do within the clinic.
Thank you, Laura. It's so nice to hear about that amazing care that's offered, and I know I've heard such wonderful feedback from mums who I've been supporting with trauma. Their experience of Rainbow Clinic has been so positive. They felt very seen, very validated, and have had the time to feel whatever it is that they needed to feel on that journey. And also amazing to hear that there is that sense of giving back to that community of people who've had a stillborn baby, so that there is more hope in the future, so that we can make more progress in preventable losses. I guess as we come to the end of our time, and it's such a big question, but I wonder if with all your experience, Laura, there's any bits of advice that you might offer to mums and families listening today who might be pregnant after loss and scared and lonely, or who might be thinking about becoming pregnant or trying to become pregnant, who are worried about that journey. What advice might you give?
I think it's very difficult for a family who've been through loss to know when is the right time to embark on another pregnancy. And I would say that only you yourself will know that. But when the time comes that you want to try again, make sure that you have those resources around you before you try to conceive. So if you haven't had the opportunity, or you've not felt ready to engage in support following your loss, whether this is peer support, joining a group, engaging in counselling, maybe think about doing this before you become pregnant, so that you've got some tools already to use when the time does come. And when you are pregnant and you're going through that journey of pregnancy after loss, remember to reach out to the Rainbow Clinic and speak to your midwife if you haven't had information about that service. Take one day at a time, and find people to speak to who have been through this themselves, because the value of peer support is incredible, and as equal, I would say, to counselling services and speaking to health professionals. Just having somebody that you can go to that understands a little bit about how you're feeling. And don't be worried about not feeling excited about this baby. Don't feel worried if you don't feel ready to pack your hospital bags or think about life at home after you've had the baby. It's very normal to just be able to cope with one day at a time and what's happening to you on that day, and that's fine. Lots of people are so excited when a pregnancy is announced, and when you've been through loss, you sometimes don't feel that excitement straight away, and you don't know how to react when people are excited for you, and you find that people around you want you to be healed almost and want you to be happy and are happy for you. And it's fine not to feel that happiness and that excitement, and to get through it in your own way. Set your own boundaries so that you feel safe in what you're doing and that you're looking after yourself, and don't worry about what other people think.
Absolutely. Yeah, I would definitely agree that navigating pregnancy is a very individual thing, and having expectations of yourself to feel a certain way can be really problematic. And actually it makes sense to feel uncertain, to struggle to get excited, to feel sad at times, and to feel good and happy and excited at other times. So yeah, I would definitely second everything you've said. And I think one of the things we would definitely agree on is being kind and gentle and compassionate with yourself about whatever it is that you're experiencing.
Definitely. And you know, you're right that it's wonderful to feel that happiness and joy again, you know, when you've been through loss, but recognizing that you might feel the grief from your previous loss, you know, running alongside that happiness and allowing both those things to run parallel to each other. Can be difficult and challenging, but it is possible, and it is possible to feel happiness and joy and excitement alongside feeling anxiety and grief and worry.
Absolutely. Those two things being true at once: happiness and hope that a new baby is coming, and also a deep sense of sadness and loss that the baby you had isn't there. And honouring that in your pregnancy and in your journey to birth is really important as well. Thank you so much, Laura, for all of your thoughts. I think we could talk and talk, and we'll definitely have to meet again for another kind of podcast. I'm mindful that there's lots of stuff out there, as you say, peer support, counselling options, voluntary bodies like SANS who are supporting people to navigate their grief, and we won't be able to list all of those here today, but I wonder if somebody's listening and they wanted to access some of those more national kind of things that are available. Is there a certain signpost or certain place you'd suggest to look? I know there'll be lots around on this particular week, but where do you tend to direct people to?
I think that SANS, as you mentioned, being a national charity, are very easy to access. They have an app you can download to your phone. Their website is a wealth of information, and they support families and extended families through any type of loss at any gestation. And the Mariposa Trust, another national charity, offer all levels of support for different areas, whether you are going through the loss of a baby or the journey into a rainbow pregnancy. So, you know, they're probably the two most well-known national charities to have a look at, I would say.
Thank you so much. And to say to everyone who's listening, if you've been affected at all by what we've been talking about today, you can access support through your GP, your health visitor, perhaps your midwife, or you can call 111 who have mental health experts on hand. You can also go to the Southern Health website and click Help in a Crisis, which has a list of local support contacts. Thank you for listening to Conversations with Perinatal Psychology, talking about maternal mental health, because your mental health matters both for you and your family. Thank you.